Is the digestive system in the lecture?
No.
No, we didn't even start it yet. We didn't even start it yet.
Huh?
Maybe after we didn't start.
So the digestive system you also have in the lecture. And this is digestive system means the system which is responsible for digestion, absorption, right? Excretion, all things together. When you take the food, what type of food they start digesting into the mouth? What kind of food they start digesting into the oral cavity? Which one? Carbohydrate. Okay, carbohydrate. Salivary amylase we have on the mouth. They start from mouth. Protein and fat, they have to go into the system, onto the intestine. Protein, little bit with the acid and pepsin can happen into the stomach. And here, digestive system has subdivisions, right? Digestive tract and accessory organs. Digestive tract and those who are not here, give them the study guide, okay? Those who are not here. Okay, so the digestive tract and accessory organ. What are the organs involved in the digestive tract? Esophagus? Okay, who will say this too? Mouth, pharynx, okay, esophagus, keep going. Can you divide the small intestine? Can you divide? Pancreas is not in the digestive tract. Keep in mind.
Stomach.
Who can tell me in order? Go ahead. Digestive tract. Mouth, pharynx, esophagus, the stomach. Okay, don't help. Don't have to.
Small intestine.
Can you divide the small intestine? The small intestine has component, right? Duodenum. Duodenum, jejunum, ileum. You have to now because you are SCB 204. If you are SCB 203, okay, there is mercy. But 204, you should know that. Duodenum, jejunum, ileum. Then, okay, divide. What is in the junction of the large and the small? Cecum. Cecum is at the junction, connection between the small and the large. And large intestine, what are the components? And appendix is attached to the cecum. Appendix is attached to the cecum. If you have that, right? Yeah, you have that. And then large intestine, first it goes upward, which is called ascending colon. Then it makes a transverse, this one, like this, which is called transverse colon. Then it is coming downwards, which is called descending colon. Then it makes a S-shaped S. That's why it is called sigmoid colon. Sigmoid, S like an S. And then rectum and uncum. These are not difficult, but you just need to remember. So mouth, pharynx, esophagus, stomach, small intestine, which I gave you the parts, and large intestine. And don't add the pancreas. Pancreas is what kind of organ? Huh?
Gland.
It's a gland, but is it on the digestive tract. Huh?
For
It
him,
is an
he's-
accessory. Listen, pancreas, nose, that is an liver, gallbladder, that's accessory, not directly attached. Here, accessory. So, what are the accessory? Here, tip, tongue, salivary gland, liver, gallbladder, and so pancreas is part of the accessory. What they do?
They
Teeth.
help.
Teeth. They help main for the digestion. Teeth is grinding, cutting. Tongue, taste, and processing. Also saliva. Salivary gland, they have mucus, they have saliva, they mix up. And some sort of digestion can start over here with the carbohydrate. Because the carbohydrate digestion, amylase. Salivary amylase. Saliva has amylase enzyme. And that enzyme responsible for digesting the carbohydrate.
What's the spelling?
Which one?
Amylase.
AMYLASE. Amylase. AMYLASE.
Oh, it's an enzyme.
It's an enzyme. It's an enzyme in the oral cavity. Liver. What the liver is doing?
Toxins.
Huh?
It flushes out toxins.
Metabolism. Metabolism. The chemical reactions. Gallbladder. Gallbladder. What they help? How they are helping the food processing? Gallbladder. Think something. You need to think. What is inside the gallbladder? You don't know gallbladder? What is inside? Huh?
Doesn't it help with like cold symptoms or something?
No.
No?
Have you heard the name of gallbladder?
Yes.
Yeah.
Right? And did you notice some parents, they cut their gallbladder, remove the gallbladder? You know that?
Is it
Huh?
to do with appendicitis?
No. Appendix is a different.
Is it different?
Gallbladder contains the, what is it? Bile. They contain the bile, which is formed in the liver
Liver.
and stored in the gallbladder. Here, this one. Look at this.
It's very small.
This one is the gallbladder. Some parents, they have severe pain, and then they do the ultrasound and see if the gallbladder is inflamed, and then doctor cut it, making an opening and then take it out. You never heard this? None of you? Good. So the gallbladder, acute cholecystitis. Cholecystitis means inflammation of the gallbladder. So the gallbladder, what they do? They store the bile.
What is bile?
Bile is it's a chemicals which is formed in the liver, and this bile, what it does, when you take the fatty food, the bile secretes, and what it does, it fraction the fat, big pieces of fat you swallow, and then how we have enzyme for fat, but that enzyme, unless you make it a small piece, they cannot work. Next week we have a chemical digestions. We'll show them. So the bile is responsible for breaking down, and then what happens? Then the lipase enzyme, they digest it. Lipase is coming from the pancreas. Okay. Now, those who remove the gallbladder, what is going to happen? If we remove the gallbladder, the fat cannot be digested. And that's why those who remove the gallbladder, the doctor advised them to not take the fat. So, they usually take the meal without fat. A little amount is okay, that can be possible. Because the pancreas is there. Pancreas has 3 types of enzymes. one for carbohydrate, which is called amylase, one for protein, which is called trypsin. Those are written inside. One for fat, which is called lipase. Those are the three enzymes which is coming from pancreas. Any questions? And here you can see, this is the diaphragm, right? This is the stomach, and this is the gallbladder, liver, as you see here. And this is the inside intestine, and this is the large intestine. Within the large intestine is the small intestine. This is the cecum, and appendix is here. Appendix is also very much prone to infections, and that's why young people, they can suffer appendicitis. When the food particles, they come from here, and then when they come here, maybe 1-2 particles, they can go into this because it's a hole. They can go inside and block the hole. As soon as it blocks, there is an inflammation over there, which is called appendicitis. On the right hand side here. As soon as somebody has appendicitis, they complain of pain. I have severe pain here, including fever, including vomiting. These are the associated signs which the doctor understands. Most of the patient is she. Does not mean there is no he. He also there, okay? But the she is more than he. Okay? Because what is the reason? One of the reason is like fat. Women has more fat. But almost both of them, they suffer these conditions. When I was an intern, my first surgical operation was this one, the appendix, to remove the appendix. So cecum, appendix, then this is the ascending colon, and this side is transverse colon, and then you see here, that's the descending, and then S shape, which is sigmoid colon, and then rectum, anal canal, anus.
How you differentiate the small intestine?
From?
I mean, you said 3 parts.
What?
There's 3 parts.
Oh, 3 parts. Okay. So 3 parts. We have some. It is difficult to differentiate, but the first part, 1/3 almost. That's duodenum. Second, middle part, which is connected to the pancreas. So we have a connection. I have the picture. Look at this. This is a very nice picture. This is intestine. He is coming from top, from stomach, coming here. As soon as this is duodenum. As soon as in the middle of the duodenum, which hooks the pancreas. The pancreas is a horizontal gland, like sitting this way. It is one of the vital organs. Why? Because this organ, they secrete both enzymes and hormones. Both enzyme and hormones. That's why it is. What kind of gland it is? It's a mixed variety of gland. Do you know the exocrine and endocrine gland?
Yeah.
What is exocrine? What is endocrine?
Endocrine it secretes into the blood.
It secretes into the blood the hormones.
Yeah.
And exocrine?
They use a duct.
It uses the ducts. Both criteria he has. This is what the hormone secreting is. What type of hormone he is secreting?
Insulin.
Insulin and glucagon and somatostatin. 3 hormones. But everybody knows insulin. Am I correct? So that is a hormone. That's why it is endocrine gland. Now look at this. He has a duct. Can you see that? That's why it is exocrine gland. because it has both exocrine and endocrine criteria. That's why it is called mixed variety of gland. We have not too many mixed variety. One is pancreas, the other one is, which one the other?
All right.
Reproductive organ, which one? Testis and ovary. Testis and ovary. Testis, they secrete sperm, they secrete hormones, testosterone. Ovary, they secrete egg, and they secrete hormones, estrogen, progesterone. So that's why the gonads, the reproductive organ, that is also a mixed variety. Now look at this. This is the duct. As soon as you are taking the food, depending on what kind of food you are taking, let's say you are taking the carbohydrate, right? Have you taken the lunch today? What did you took lunch?
Chicken and rice.
Huh?
Rice and chicken.
Rice and
Chicken.
chicken. Okay, let's talk to her. She took the rice and chicken, right? So she cut it in the mouth. The rice is carbohydrate. Chicken is protein. As soon as it comes through the esophagus, comes to the stomach, then what happens? The stomach has acid. They mix up. The stomach is just a storage organ. It keeps it stored. So it forms it with the acid, it forms a kind, bolus. And then, let's say the bolus is this much. Not the whole thing, they can come into the duodenum. Because the stomach, at the end of the stomach, it has constricted area. So the food cannot go all at a time. A portion of the food, they can pass through the pylorus into the duodenum. As soon as they come into the duodenum, she took the carbohydrate and protein. So the pancreas, it secretes 3 enzymes: amylase, lipase, trypsin. Because it's a carbohydrate, so the amylase is coming here. This is the opening. And also another opening from here, look at this, is united with the pancreatic duct. This is called bile duct. These two openings both opens into the second part of the duodenum. You don't need to memorize. Second part means duodenum has 4 parts. They open into the second part. As soon as the food carbohydrate comes here, he knows the carbohydrate is coming. So he secretes the enzyme amylase and then break down. Because she is taking the protein also. So the trypsin also coming from here and breaks down. All the digestion, they occurs here on the duodenum. As soon as they have digested, they go into the jejunum. What the jejunum is doing? Jejunum is waiting. There are millions of villi and microvilli over there. You know that villi. Those are extension of the membrane, plasma membrane. As soon as the digested particle, they come into the jejunum expand. Whatever they have in empty conditions, when the food is coming, they can expand by 20 times the microvilli. Why they expand? Because of absorption. Now, whatever nutrient you have from carbohydrate, that is glucose, and from protein, that is amino acid. These two, they absorb into the jejunum. Absorption means the nutrient, they go into the blood system, into the blood system. That is glucose and amino acids. And then the rest of the process then starts. The metabolism. The glucose goes high, and then pancreas again now secrete the hormones to take the glucose into the cell. As soon as the glucose comes into the cell, the glucose breaks down. And there are multiple enzymes over there. They form the glucose into pyruvic acid. And that pyruvic acid, it has 2 processes. one aerobic, one anaerobic. Have you heard this name? Aerobic, anaerobic. Aerobic means with oxygen. Anaerobic means without oxygen. If the cell does not have enough oxygen, then it goes into the anaerobic system, which cannot produce too many ATPs. And they form lactic acid. And lactic acid is toxic. As soon as the person takes rest, oxygen comes. And then this lactic acid again convert into pyruvic acid and go into the aerobic system. And finally they form lots of ATPs. This is how the whole process happens. And that's why now I am talking. If I don't have ATP production, I cannot talk. You need energy, right? Am I clear? This is the whole process. Yeah. Okay, so these are accessory organs, and they might give you on the rats to identify those. Who is interested today to dissect? Raise your hand. Who is interested? Huh? Why you are putting like this? Raise your hand. Yeah, one, you. Okay, this bench is fine. How about here? Each bench you have two. They're thinking. Okay, both are. Each bench you have to. Okay. So whoever, I'm not forcing anybody, but if you do that, that will be best. I'll show you some video before you do that. And so, any questions you have? Those who are coming late, can you come and sign, please? Sign and also take some study guide for the lab, for the practical, second practical, just one page. Okay, those who are coming late, this one. Okay, next. Okay, listen. Next, the structure. The structure of the digestive system, or more or less, because it is almost similar from esophagus down to the anus. But there are some difference also. But most of them is similar. What are those? Innermost mucosa, simple columnar epithelium. Stratified squamous epithelium, where can you find it? In the esophagus. Why? Because esophagus, the food oral, there is a friction. That's why esophagus and oral cavity, they have multiple lips. And also in the anal canal, because of the stool, they can pass. Then submucosa, then muscle. Most of the intestine, they have inner circular, outer longitudinal. Exception is in the stomach. Exception is in the stomach. The stomach has how many? 3 layers. Outer longitudinal, middle circular, inner oblique. Let's show you. Yeah. Yeah. Look at this. How many? Outer longitudinal, middle circular, inner oblique. How many? Why stomach has 3? Other intestine has 2. Why?
So it can
Smoke
stretch.
has to push the,
Huh?
it has to push the
Stretch.
food.
Because The stomach, it has acid. Because the stomach has acid. That's why he needs extra layer to protect.
What acid? Just acid?
Hydrochloric acid. The food, acid reflux in the morning. Well, how do you feel? Right? Comes up and chest burning. Sometimes stomach pain. Why the stomach pain? Because of acid. Peptic ulcer. Have you heard the name? Peptic ulcer.
Yeah.
So that is acid, due to acid. And that's why everybody should take the food in a disciplined way.
You know what?
Disciplined means, let's say you took the breakfast. What time?
Today,
What time?
8.
8. She took 8. Somebody even don't take the breakfast. Somebody here?
Yeah.
That's not good. Do you know all 3 meals out of breakfast, lunch, and dinner? Which one is the most important? Breakfast. Why? Because the whole night your stomach is empty. Nobody is eating at night. Unless you are really hungry, go to the kitchen and take this. But most of the people, they don't eat. So what happened? The acid secretion into the stomach. And then morning, okay, those who want to, somebody there, dieting, that's a different story. But normal, healthy person should take the breakfast as much as possible. But breakfast time, because of acid, they don't have the desire to take the breakfast. Am I correct? Nobody wants. Even if you ask me, I don't want. But because I have to talk, I have to eat. And then I come here. So that's why breakfast is the most, and then lunch is up to you. Then dinner you should have heavy. But if you make the difference too much longer time, should not be more than 4 hours. 3 to 4 hours is the standard. At least something you should eat. Otherwise, what will happen? Acid will come continuously. And then it will make a peptic ulcer. That's why so many young generation, they have a stomach pain.
Don't they say it's better to fasting?
Pardon?
Intermittent fasting, like not to eat for
Fasting.
each hour.
Fasting, that's a different explanation. Okay? Muslims, they are fasting from sunrise to sunset. It's almost 16 hours. That has different explanation. That time, those who have stomach problem, they really have some back time. But again, when they take it, because it is 1 month, when they take it, they habituate it. So the breakfast again, the most important meal. So there are 4 layers, and the acid is here. And do you know the pH of this acid on the stomach? How acidic? How much pH?
6.
The one which the hydrochloric acid in the chemistry, they use the acid, hydrochloric acid. And the pH of that is 2 to 3. The one which is here, the pH is 0.7 to 1.5. 0.7 to 1.5. Which means, if I dip my finger over there, when you take this out, you'll see the bones. You'll see the bones. How come we are carrying the 0.7 to 1.5 pH in the stomach? Because of extra layer. Because of extra layer. Because membrane is covering and then extra muscle layer is protecting. So we discuss here, and serosa is the outer layer. And okay, I'm not going too much details, but I'm doing here. But because you also have a lecture, because we have some models, we have dissection today. So whatever is needed for the lab, digestive system is a huge. If I start doing the talking, in a couple of hours we can do that. But since it is a lab class, so just to see whatever you need. This one, as you see here, this is the diaphragm. This one, right? Separates the thoracic cavity to the abdominal cavity. And this one, this is a plexus, nervous plexus. One is mesenteric, one is submucosal, two plexus. And muscle layer, two layers, most of the case, inner circular, outer longitudinal. And this is the lumen, as you see here. This is the the one which I just talked with you. The nervous system, which is submucosal plexus and mesenteric plexus, which is called Orbich and Missinus plexus. They are not going to ask you this one. And mesenteries. What is mesentery? Those are mesenteries, those are connective tissue sheets which suspend the stomach and intestine from abdominal wall. Holds the abdominal viscera in proper relations to each other. Now the mesentery we have parietal and visceral. Parietal means the one which is covering the whole thing. And visceral means the one which is attached to the organ. Lesser omentum and greater omentum. Lesser omentum is on the lesser curvature of the stomach to the liver. Greater one, greater curvature of the stomach, which covers as an apron. Look at this. This is the lesser curvature, this one, from here to here, and connected to the liver. This is the greater curvature, outer side. And this one is the apron, greater omentum. It covers the whole intestine. Any questions? This one, mesentery of the small intestine, they hold many blood vessels, as you see. So many blood vessels is here. Mesocolon. The mesocolon, this one, and momentum is this one. The mesocolon, they anchors the colon to the body wall. Here, colon to the body wall. Here. Now is one by one, okay? Not everything you need for lab. Most of them you need for the lecture. The mouth, what is the function? You know that, right? This is the oral cavity. Teeth. This one is the uvula, right? When you go to the dentist, what they do? Open the mouth and say, or if somebody has infection into the neck, they have to open the mouth, right? And say some sound so that the uvula can move. And this is the tonsil, here and here. Most commonly affected tonsil, which is called palatine tonsil. How many tonsils do you have?
3.
I talked to you last week. How many?
5.
5, but then
How many I said?
5.
And how I said?
2 pairs and 1.
2 pairs and 1. 5. Okay? Palatine, lingual, okay, and adenoid. This is the most common. That's why people knows how many? 2. People knows. And submandibular and sublingual gland, which is here. Submandibular under the mandible. Sublingual here. They secrete the salivary secretion, saliva. Tongue you don't need for the lab here, okay? This you might need for the lectures. What is the lining? Non-stratified, non-keratinized, stratified squamous. It has, tongue has papilla, test part, lingual palate. Here is the tongue. This is the V-shaped area. The lingual tonsil is here. Palatine tonsil is here. Different types of papilla for different type of taste. Bitter, sweet, right? Some are,
Umami.
umami is a different kind of thing. Sweet, bitter, acidic. Saliva, what is the function? It has moisten, starch digestion, carbohydrate digestions. Amylase, which enzyme? Amylase. There is the salivary gland. What they do? How many salivary glands we have? How many? How many pairs? Huh? How many pairs salivary glands do you have? How many? 3 pairs. How many you see here? 3 pairs. Parotid, which is here, in front of your earlobe. This too is parotid. Parotid is important. Why? Because of mumps. Do you know mumps? MMR, measles, mumps, rubella. You know the mumps. Mumps is a disease which is infection of the parotid gland. Then submandibular, sublingual. All of them are paired. Look at this. Submandibular and sublingual and parotid. And those are in exocrine gland because each of them they have a duct here. Can you see the duct? Each of them has a duct. That's why they are exocrine. Esophagus. Esophagus is almost 25 to 30 centimeter. Means how many inch? How many feet? Can you divide 30? Huh? 6?
11.
Wait. So how many?
12, about 12 inches.
12 inch. 12 inch, yes. 12 inch. 12 times, yes. 12 inch. Because 1 inch equivalent to 2.54 centimeter. Begin at C6. Extend from pharynx to cardiac orifice of the stomach. Passing through the esophageal hiatus of the diaphragm. Because this organ, it has to penetrate the diaphragm and then come into that body. Right? Without penetrating, they cannot come. Am I correct? Prevents the stomach content from regurgitating into the esophagus. That has a sphincter in the esophagus, lower esophageal sphincter. What is the purpose of this sphincter? What is the purpose? What they do? The sphincter? Because after that, stomach. What is inside the stomach? Acid. In the morning, what happens? Reflux. Because too much acid whole night. So they try to go upward. And that's why you don't feel good. Somebody they try to vomit in the morning. They don't have the intention to eat something. until couple of hours, because he tries to go upward and the valve is preventing. But still, somebody might have. That's the acid reflux, regurgitations.
So the splinter is like a valve.
The sphincter is a valve. The sphincter is a valve. And that prevents the regurgitation from into the esophagus. Now what happens if it all the time goes upward? What will happen? What will happen? What is the lining of the, what is the epithelium into the stomach, into the esophagus?
Epithelium.
What kind of epithelium?
Stratified.
What kind of square? Stratified. Esophagus has stratified, multiple layers. What is the epithelium into the stomach? Into the stomach. What kind of epithelium?
Non-squamous.
Huh?
Non-stratified.
What?
Non-stratified. Or
Non-keratinized.
non-squamous.
Now in the stomach it is simple column. The most of the digestive tract is simple, except the portion which has friction. Esophagus has a friction. Anus has a friction. Oral cavity has a friction. That's why it is stratified. Everything else in the intestine, in the large intestine, stomach, it has simple columnar epithelium. Now, what will happen? The acid is going upward. Going go up and then come down, up and down. So what will happen? The simple columnar epithelium, if it is long time, they change the lining of the esophagus. So the stratified is going to convert into simple column. Is it a good thing? No. This is called metaplasia. One kind of epithelium transforms into another kind of epithelium, which is called metaplasia, and which is a sign of it can be in letter tumor. I don't want to say the word cancer. Okay, this is I want to usually I say tumor. It can be benign, it can be malignant. If it is malignant, that's cancer. You see the heartburn? Even some of you might have. The heartburn is a common. Sometimes I also have. It's a common thing. Stomach is a sac, means cavity, and food storage. How big it is? 1.5 ml, 1.5 liters. But if you take too much food, look at this, it can extend up to 4 liters. And what is the pathway of food? Once you take it in the mouth, all the steps I have shown you here. Why I have shown you?
It's gonna be on the exam.
She answered my question. Okay, whatever, that's why I said I'm giving you almost everything. So you have to, all the steps is here. And follow those steps. Now, if you are missing some of the steps, what will happen? The point will be missing. So we take it up to ileum. After that, you can go into the large intestine up to. Now the stomach head is J-shaped, divided into 4 regions: cardiac region, fundic, modic, and pylotic. Okay, these are the 4. Now look at this. It has 2 curvatures, razor and greater. Here. This is fundus. This part with the esophagus, it is cardiac. This is the body. And this one is the pylorus. Most constricted part. Can you see that? So the food is here. They cannot pass at a time. They have to go little by little. And what are those here inside? Huh? You see the fold, mucus fold? What are those?
Gastric.
Gastric rugae. This will be on the practical. They'll ask you what is it? Gastric rugae. Be careful with the spelling. Don't write it R-O-G-U-E. Look. That's it. That's a car. Nissan Look. Huh? Yeah. That's the fold, right? That's the mucus fold. Why there is a fold here? Why there is fold? Why they are folding? Are you feeling sleepy? Nobody wants to talk anything. Even mistake, say something. See something, see something, say something.
Is it to increase the area?
That's it. You know that. So why you are not want to talk? You should give me some rest on my voice. Okay? I have been talking since 8 o'clock. Okay, so the rugi is for when it is empty stomach, this is empty. And you can see the fold. The moment you take the food,
It flattens.
it flattens. How it becomes 4 liters? It flattens. 4 liters is a
Yeah.
lot. Usually 1.5 liter, normal. But if somebody overeating, 4 liters. 4 liters means, let me give you an example. Did you buy the milk gallon? That's 4 liters. That's 3.89 liters. That much bigger.
Then where is the microvilli?
Huh? Microvilli is in the jejunum, intestine.
Oh, it's in the intestine.
Each of them, they have a different things. Villi and microvilli, both are in the jejunum. What they do, they absorb
Their
and
their
increase
function
the
is the
surface
same
area.
to increase surface area.
Increase the surface area to absorb. Here, they increase the surface area to store more. They don't absorb, except one thing, which is aspirin. You know aspirin? Aspirin is a tablet for pain. If somebody takes the aspirin, that is absorbed into the stomach, which is not a good thing, which is a bad thing. So it is storage. And they might ask you a lot of questions over here. This is rugae. This one, which layer, what? This is fundic. This is cardiac. This is the orifice to enter from esophagus. And this is the pylorus. So this one is gastric rugae, right? It's on the stomach. And here, look at this. Can you see the circular fold here? They just show you one section. But there is a fold. Can you see that? This is called plica, P-L-I-C-A. Plica circularis. C-I-R-C-U-L-A-R-I-S. Plica, P-L-I-C-A-E. Plica circularis. I have those in the name. So what they do? This plica circularis, that is also fold. Why they are fold? Why they are not smooth?
Pass the food.
We are scientists maybe, but as I said, he is super scientist. He is super scientist. What he is doing, that everything is super scientifically, when we cannot think what he is doing. Each of them has a purpose. Why it is circular fold? To slow down the food. If it is smooth, what would happen? Could easily pass away, but they don't want. Let them digest properly. That's why those fold is there. Yeah, stomach lining is simple columnar. Mucosa and submucosa are flat when the stomach is full. But the longitudinal wrinkles called gastric rugae when it is empty. And 3 layers is here. Gastric pit, which is a depression into the mucosa. Lined, same lining. What are those? Cardiac glands, pyloric glands, gastric glands. Cardiac, pyloric, and gastric glands. They secrete different kind of secretions. Now, this one is important for lecture because in the quiz they will give you questions, and also for some of them for my lab. Mucus cells, what they secrete? Mucus. Parietal cells, what they secrete? And intrinsic factor. This is most important, hydrochloric acid and intrinsic factor. What is intrinsic factor?
Inside.
Huh?
In the blood?
What they do?
Blood protein?
No. Anybody knows? Let's say somebody is vitamin B12 deficiency. Somebody has, somebody is anemic and vitamin B12 deficiency. What is the condition when somebody has vitamin B12 deficiency? What is the name of the condition? Huh?
Anemia?
What?
Endemic? Anemia.
No. Starting with the word with the letter P.
Pernicious.
Pernicious anemia. Vitamin B12 deficiency causes pernicious anemia. Okay? And when somebody is anemic, what you do in case if you think, okay, your hemoglobin goes down, what measure you take? Iron. You take the iron, right? First of all, you take the iron containing food. If it does not work, then you go to the doctor. And the doctor advises you to take the pill, iron pill. When you take the iron pill, what happens? After 5 days,
You get constipated.
after 5 days, you will stop without asking the doctor.
That's
Because-
why you need to take gentle iron. There's 2.
Hold on. So, that causes constipations. And then you stop it. Even if it does not have constipation, let's say you take 1 year of iron. And after 1 year, you check the blood if it is improved. But when you check it, you saw no improvement. Rather, more down. Hemoglobin is more down. Why?
This is not getting absorbed.
It is not getting absorbed. Why? You are taking the pill, but it is not absorbing.
You need to take another pill.
Because the intrinsic factor, which is secreted by the stomach, parietal cells, somebody might have deficiency of these cells, deficiency of these factors. So if somebody has deficiency of these factors, as much as you are taking, getting out, no improvement. That's why what you need to do? Injections. We have to give injections. If you take the injection, he can bypass the stomach and then go into the system.
What about the infusion?
That also can be possible. Infusion when somebody is too severe conditions.
Oh.
I don't have time. He is going to die. push. Okay, this depends on the situation. So they give it here, so that does not need the intrinsic factor. So it can goes into the stomach. So intrinsic factor is the one which helps in vitamin B12 absorption and iron. And this is secreted by the parietal cells. Chief cell, what they do? Secrete lipase and pepsinogen. Gastric lipase, but this gastric lipase, you might say, pancreas has a lipase, he also has a lipase. What is the difference? This lipase cannot digest the fat. The pancreatic lipase, it is stronger than this, so he can digest. But before he digests, what happens? The gallbladder is secreting bile. So that the emulsification means next week we have emulsification. Next means the big fat into pieces, the bile. And then the lipase enzyme, they digest it. So don't forget this slide, this is important. Oh, one question I have for you. The small intestine is 30 feet. Large intestine is 5 feet. Why the small is not large?
It's narrower.
Which one?
The smallest.
Narrow, right? So that's why?
It's longer.
No, how
Because
did,
it's narrow, that's why we call it the small.
that's
Large
is correct.
It's bigger and
So
narrower.
the small and large intestine does not depend on the length. It depends on the diameter, as she said.
How much did you say the small intestine was?
In some book is different. 30 feet, I think. Yeah. 30 and 5 feet. Check it if I'm not wrong. So, large intestine is the diameter. You see the diameter? How big is the diameter? Yeah. And this is this. This is just a coil, but this one is huge. Liver. Liver is the largest gland of the body. And how much weight? Almost 1.5 kilo. 1.5 kilo. Function? Secrete the bile for digestion. Liver detoxify chemicals and metabolize drugs. Also makes protein. For liver has lots of functions. This guy. That's why when somebody goes over 60, their liver makes a problem. Because whole life, this organ, they are fighting with you. You are taking medication with or without reason. Right? Pain medication, lot of other medication. Oh, I have headache. Let's take Tylenol. One is not good. Give me 2. You are taking 2. Next day, I have still headache. Give me another 2. Who is fighting with this pill? The liver. 95% drugs, they are metabolized in the liver. 5% they go through the kidney and other organs. So they detoxify chemicals, metabolize the drugs. The liver also makes protein, which is responsible for blocking factor. Right? So he is one of the very important organs. This one. This is human liver. Human. What we will do today, that's rat. Rat has multiple lobes. When you see, you will see that. Multiple. We have 2 lobes basically, right and left. and this is the anterior view. The right one is bigger, left one is smaller. And the gallbladder you can see the whole gallbladder here. This is the vena cava. This picture, try to memorize, okay? This is the gallbladder. This is the neck and the duct, cystic duct. This is the common hepatic duct. Together they form the bile duct. And the bile duct, they come and unite with the pancreatic duct together and form the major duodenal papilla. Okay, this is important for my written and for practical, both of them. This is also called hepatopancreatic sphincter. That's a valve. This valve usually close the gap, because when the food is not there, we close it. The moment food comes, he opens, and according to the type of food, the pancreas, they secrete the enzymes. There is the opening. Hepatopancreatic sphincter, or we can say sphincter of Oddi. I might give you sphincter of Oddi. What is it? Don't say, oh, he did not say that. Okay, so all major duodenal papilla, hepatopancreatic ampulla, this part. This one for the lab, for the written exam, I might give you some pictures. You need to know, identify. This one is what? Pancreatic duct. These two, because this is the opening. This one is gland, pancreatic islets. They secrete the hormones.
What's acinar cells?
Cells, they secrete the hormones. Can you read that? What is the function of the gallbladder?
Store bile.
Don't say secret bile. Storage of bile. He does not have the capacity to secrete.
Bile is secreted by liver.
Who is secreting the bile?
Liver.
The liver. Most of the students, they confuse here. Gallbladder is simply a bag, a storage bag. He is storing the bile. What is the lining? Simple columnar and neck. Sometimes what happens, if you look here on the neck, look at the neck. Sometimes the bile too much concentrated, and when it is too much concentrated, they form a stone. And that stone, when the bile comes, try to come here, they stuck on the neck. That is stone. And when they stuck on the neck, next time when the person taking the fatty food and bile is trying to come, they cannot. As soon as they stuck here, it inflamed. And when it is inflamed, that's called cholecystitis. Chole means gallbladder. Cystitis means inflammation. Inflammation of the gallbladder. And this one inflamed. And what will happen? The person is cleared. And this pain is on the upper part, on the right side. Appendix on the lower part. And who are the victim for the gallbladder infections?
He or she.
4F. 4F. What are those? 40. Female. Fair. White skin. And fatty. So there are 4F, okay, who are the victim. That does not mean the man is not the victim. But who are the most? Women are the most. Okay, 40, female, fair skin, white skin, and fatty. Those who are fat, obese. So 4F. We always abuse the F word. But here, we are using the F word. Pancreas, can you read that? I think I talked already. This one I already talked, right? Endocrine and exocrine. It is both. Why it is both, I explained that, yes? Any questions? If you have question, you can ask. It's a mixed variety of plant. The small intestine. All chemicals, digestion and nutrient absorption occurs in the small intestine. Duodenum is for digestion, jejunum is for absorption. Ileum, he also absorbs what he absorbs? Salt and water. Salt and water. Rest of the item is in the jejunum. The small intestine, longest part, 5 meters. Up to 8 meters when it is dead, because it takes part. The small intestine refers to the diameter, not the length. This is the junction, cecum, ileum, and that is starting the large intestine. And look at the stomach on the left side, and this is pylorus. It's a coiled mass in the abdominal cavity. Divided into 3. We'll discuss that. And this is what? Tell me, what is the difference?
There's a bone.
There is a I, there is a E. What is this?
In the stomach.
This one?
Bone.
That's the bone, okay? Don't confuse that. You might say, okay, write this one on the digestive system. Digestive system is this one. You need a break? Take a break. 10 minutes.
Yeah, was number 5 to 8 더 written 디. 아니 lab 디 6 to 10.
이거 뭐 이래 따워
But just make sure that whatever you are missing.
Yeah.
Professor, so this lab, this one, it's in the written?
Today's one,
Yeah.
both for written and for lab.
Lab.
I mean for coming
Huh?
For the coming written, right?
For the coming written and for the coming practical also.
Alright, thank you.
Check the syllabus. Check the syllabus.
check some stats guess there yes there these there are kidneys
근데 아니 위종 올리므라고 해.
대좀 마음 거들 어떻게 돼 이렇게
프라이팬.
어디가 꼬시 이거
피아노 떼서 거기.
이거
약간
디즈니 거 디즈니 기사지래
slow digestion. So stores.
콜레 다이제션 치
Slow digestion.
다이제션 치로 디즈니 기 앱소치 다이제션 이름 기간 다이제션 और 앱소치 워터 다 소트 that's okay 사내 걸로
Sati time now leaves. Color dudunum hal jagah mein.
digestion digestion की absorption ilim की water and salt
Absorb water and salt. Professor, you have a paper?
Yeah, I'll show you.
Oh.
Okay, after the break.
Okay. Ilium spelling the E, the I.
ILEUM
Ah.
ILEUM ILEUM the ilim the keyword in conscious substantive exactly
예, 특수 부드신지 말해보면. Oh,
censorship
of course, same the share. If I can get the
Добро консоль сове. Бос он сиз каудулес. Цама символишес. Ну, челд катчира. Жути элистри кейдес. Катчира. Зон айс.
German. Ondan Konya bozuyorsunuz.
주로 쇼도. 지금
요즘은 캠 내놓는다. 근데 내 너무 인지하지도 못해.
이거는 왠지
성능에는 아주 야하고 밀려버려. 야한 전화 없이 성능이 막이게 밀려. 정보를 어디까지 오라. 아, 이상이지. 다 슬라이드 있었지? 라고 했다. 裤子都不会脱，这个。